Many patients with a cervical herniated disc will go to a chiropractor even as the first step. Many of my patients have already seen chiropractors before they've seen me. I like chiropractic for the right patient. I had an opportunity to speak with a very experienced chiropractor, Dr. Lou Bisogni, about his approach to patients with the cervical herniated disc. So a patient comes to see you, they have got neck pain with pain going down the arm, maybe numbness, tingling, even a slight weakness. What do you do?
When a patient walks in our door, we have them fill out the necessary forms, a history form, an ergonomic form. We will then sit down and consult with that patient to be sure their problem. We're going to listen very intently to the details of their symptoms. And then we're going to go through a complete examination. One of the approaches is spinal manipulation. That is what we're licensed to do.
Right.
So spinal manipulation helps to restore the function of the joint in order to help relieve the pain and to resolve the inflammation.
And does that actually mean like cracking the neck? I mean, do you actually...
Okay, that's always a great question.
Sorry to ask you that.
That's a great question. It's like
people come to me and they say, I'm not going to a chiropractor. I mean, I'm not going to let them touch my neck. But I've never had a problem with you touching anybody. And just what is that? What do you do, actually?
Okay, so if the patient's going to receive a spinal manipulation, we can move the neck. The sound you're hearing is nothing more than little air bubbles releasing in the joint, little facets.
Right.
That's the sound. So that's really not anything to be afraid of.
Right.
What we're attempting to do is move the vertebrae away from the nerve if it's pinching the nerve, or to create a more healthy environment for that nerve and disc to live in. So on that next visit, after visit 1, we determined, okay, this looks like a patient that is going to be helped through chiropractic. Now we're going to do the manipulation, and that manipulation is to open up space, increase oxygenation, and all the studies show that that type of spinal manipulation will do that, increase blood flow, oxygenate the area. So by doing that, you're creating a healing effect.
So is that done with your hands, or is there like a big machine, like a traction machine? Or and that's really like, is that hands-on?
The chiropractic can be done hands-on for that type of problem, for a cervical herniated disc. Yes is the answer to that. Of course, you may not want to do that type of manipulation. There are over 20 different chiropractic techniques to get to the same end. So now after you've evaluated and found out, look, this patient has a herniated disc, I may not want to do that popping click sound. What I would want to do is maybe traction it gently, or even use, there are instrument techniques now to resolve that problem. Decompression, for example, traction. There's an activated instrument where you can actually move the vertebrae without actually twisting the neck.
So can a patient expect to feel better after the first visit, or is it something, because sometimes people come in and they'll say, let's say from physical therapy, so any type of treatment, I actually felt worse after the first visit. So what's the typical patient going to experience the first week of treatment with you?
After the first adjustment, it can go from the patient has almost a miraculous release, because that adjustment has been shown, and studies have shown also, that endorphin production, or our body's natural painkillers, are produced with that immediate thrust. Okay, so that's where the pain control comes in. Now, to actually correct the problem and keep that bone in a new position will take several adjustments so that the muscle memory takes hold. It's almost like an orthodontist, where, you know, they put braces on teeth for a certain period of time. Now the braces come off, and if you don't wear your retainer, I don't know, you have kids, I have kids, and you don't wear the retainer, costs more money. You're back there for another $6 grand. So whatever. So you know, our retainer would be to gently strengthen those muscles, etc. So week 1 up to week 4 to 6 maybe. You know, you're just manipulating gently, giving it a rest.
So the bottom line in chiropractic is that it's now a very traditional type of treatment, and many patients are using this even as a first line when they have the cervical herniated disc. For me personally though, I would not go to a chiropractor for manipulation if I had a medium to large size herniated disc and there was pressure on my spinal cord or even on the nerve. So 2 things. Number 1, look for a really good chiropractor that has good references amongst your friends and in the community. And number 2, make sure you discuss your condition with the chiropractor before you start the treatment. If you've got a good doctor treating you, I think you may do well, and it's certainly worth a try.